Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in, hold this, from the back to the front. Everything's magnified 30 or 40 times on the screen. And right off the bat, we're seeing a lot of arthritis, a lot of tearing in the labrum. Not unexpected. We'll go ahead and turn on the shaver and show you how we use this to help debride some of these tears in just a second. Okay, so we're using our shaver here just to debride a little bit of the labrum so that we can see. Obviously, you've got a lot of arthritis here. You're down to bone. So no matter what we do, you're still going to have some abnormal anatomy here. Our goal is to try and do everything we can to get you better in terms of your symptoms. It's a little bit of a wrinkle in the rotator cuff right there. But for the most part, that doesn't look too bad. This is the area we were concerned about right back. See how there's a little split tear maybe back there. We'll look at that in a little more detail. I'm going to put a marker stitch there in a minute. But right now, this biceps tendon, just like on your other shoulder, has been a source of pain. So we're going to do a tenodesis here. We'll take a spinal needle next, and then we'll pass a shuttle relay through the needle. And then we'll pass a suture through that. Hold the camera here. So next step for us is to push the gray cannula back in. There it is. And now we'll take that spinal needle, take a grasper. And with a little bit of luck, we get that needle right through the biceps just like that. We'll pass it's actually called hold the camera. We'll actually pass a super shuttle, careful here, which is a black nylon coated wire. And now we've got that in. We'll get that centered on the screen like that. We'll back out the needle. And then we're going to, stay on the screen for me. We're going to load that with a high strength suture here. This is a hi-fi. And now we're going to do the same thing one more time. So we'll take that spinal needle one more time. We will take the grasper. And that's a little bit low, but that looks pretty good. Okay, we'll take that right there. We'll pass the relay through again. And we'll show you some more after we cut the biceps tendon. Okay, so what we're showing you now is that we've released the biceps tendon in preparation for reattaching it in another place. And right now I'm passing a marker stitch across the rotator cuff right there, so we know exactly where to look when we change positions with their shoulder, which is what we're about to do. We've cleaned up the glenoid as best we can, but obviously you've got a lot of arthritis. This is the kind of picture that we see before someone has a shoulder replacement, or if they're having symptoms and we want to do something short of that kind of surgery, we do orthobiologics in the office. I think we've talked about all these things. But clearly you're down to subchondral bone here, not only on the humeral head above, but also on the glenoid down below. So, but we're done inside the joint, so we're going to go off on the video and show you some more in the subacromial space in a minute. Shaver. Okay, so we've taken off the anterior lip of the acromion, which you can see the cut edge right there. So that shouldn't cause any problems with the rotator cuff. And now we're going to put 10 pounds on the white in addition to what's already on the yellow traction. I'm kind of talking to my team here. We're just putting in a shaver now. And it's going to help us evaluate the rotator cuff. Remember, we've still got some biceps sutures in here. And we've still got your coracoacromial ligament, which is this right here, above the shaver there. So far, we haven't released it. We're going to rotate, look towards the back of the shoulder, and start back here. And as we look back here, I do not see any significant rotator cuff tearing in the back of the shoulder. We'll go off on the video for just a minute. Okay, so here's one of the marker stitches. I don't see a disruption, a significant disruption in the cuff yet. Let's put in the cannula, sorry. Yeah. We'll go ahead and put in another cannula here. And then hold it in. We're going to take a crochet hook and take out this marker stitch. Hold the camera right here, Bert. I'm going to try and externally rotate. The other marker stitch should be, there it is right there. You can just see it. I'll be able to get it here in just a second. Okay, so hold the camera. So now we've got both marker stitches, and we know that the area of the cuff that was injured on the articular side is between these two sutures. And fortunately, I do not see any lateral disruption of the tendon, so we can tie those sutures as an effective ripstop or cuff repair stitch there, just to prevent any propagation. Hold the camera here. Okay, so we've tied the bicep suture. You can see that blue suture right there. And we've released everything that looks like it could potentially affect your shoulder motion. Okay, and we've looked at the entire rotator cuff. This is far anterior. A little bit of redness on it. That's a sign of the impingement syndrome, but no tearing. You can see our bicep suture there. And then as we rotate towards the back of the shoulder, there's our cuff suture, but no detachment. So this is actually really good news. You will recover a lot quicker as a result. So we're going to finish up here and get you back to the recovery room in just a few minutes. So I really hope this does the trick for you. Good luck to you now. Bye-bye.